Hey, it's Dr. Angelina with Surgical Arts and Ideal Body Institute. Our office is located in Atlanta, Georgia, in Buckhead and Loganville and Gwinnett County. We are a full surgery center and we perform all our surgeries for body lifts in our surgery centers, not in the hospital. So that helps to save you a lot of money. So let's talk about thigh lifts today. So thigh lift, one of the common procedures that we do, usually after people lost weight. We have bariatric surgery center here as well, and therefore we get patients after their weight loss to come in to deal with the skin between their thighs. Does everybody qualify for it? No. But people who lost weight, most of them do. If there are least invasive options available, like Body Tight, where I try to tighten the skin and maybe do some liposuction, I offer that. I try to minimize scars if I can. However, I would like to make sure that patients, especially the ones that do a lot of research, speak to their surgeons exactly about what they like. So I've noticed that some people actually don't like when the surgeon says, I can do your thigh lift and stop the incision, not at the knee, but maybe halfway up the knee, halfway through the thigh. In a surgeon's view, this is a good thing. We're trying to minimize the incision. We're trying to minimize the risk of complication, potential risks, potential scar. However, some patients feel like they actually do want the full thigh lift. They do want the incision to go down. They don't care about the scar so much, but they really want that tighter appearance of their whole thighs, including knee. So please voice your opinion to the surgeon, because there might be a disconnect where surgeon thinks that we offer you a minimally invasive or least invasive surgery, and the patient's actually looking for something else. So I always offer two options. If you qualify for surgical lift, generally there's really not another option. We have to cut the skin off. But some people may qualify for liposuction and Body Tight, which is a skin tightening procedure, and I always give that option if I feel like you would qualify for it. Prices of the surgery, I've discussed it in previous video. However, my prices are listed on the website. The price includes obviously a preoperative visit. It includes your surgery, surgeon's fee, operating room fee, anesthesia fee, and your postoperative visits. It is possible to get discount if you combine multiple procedures. Obviously, people who lost a ton of weight and need a thigh lift, a lot of times they also need arm lift, tummy tuck, breast lift, back lift, many other options available, and so combining those procedures sometimes may save you some money. Risks and benefits. So risks, most of the time when we do thigh lift, I do it under general anesthesia. So the general anesthesia risks will apply towards this procedure. So every time you go to sleep with general anesthetic, the usual anesthesiologist comes and talks to you and tells you all the risks and benefits of that. Those apply for this procedure. Incision, when we do surgery like this, incision extends from your knee most of the time. Sometimes we do it a little lower, extended, sometimes a little higher if I feel like I can spare the incision right by the knee. But generally from knee all the way up to your groin area. Sometimes we actually have to make it L-shaped, meaning incision goes all the way up the thigh and then into the groin. Again, it all depends on individual person and their anatomy. Those incisions are very long. It's going to take time to heal. So most common things that people ask after surgery, when can I start taking a shower? In my case, usually I say 48 hours. When can I sit on the toilet? Well, you can try to sit anytime. It might be uncomfortable. So we try to be creative and offer solutions for our patients that may help them. When the bandages come off, that will depend on your surgeon. In my practice, you don't touch the bandages until I will touch them myself at the follow-up, and usually not in the first follow-up. It might take a couple of weeks. However, I know there are surgeons out there that use different means, glue, different type of tape, and so that might take a little longer to take the tape off, or shorter based on where you go. Garment, we usually order garment for you unless you have your own, and try to make suggestions based on your body type, because everybody's a little different. Some people are very skinny after they lost all the weight. Some people still have bigger hips, and so certain garments will just not fit here. and also depends if we're combining it with tummy tuck. So there's a lot of things we need to look at while we're ordering garments. So I at least consult with a surgeon before ordering your own. Other things that came up, scar creams. I obviously recommend those once tapes come off. We have certain types here in the office, but simple vitamin E and cocoa butter probably will do just as good of a job. And of course, SPF cream. Every time you're exposed to the sun with those thigh incisions, if you're going out finally wearing shorts or whatever, swimming suit, SPF, SPF, SPF. We don't want those scars to darken. Other therapies available for scar as well. Can those incisions break? Yes, it's one of the risks of the surgery, that sometimes long scars have, the longer the scar, the longer the healing time, more chances for it to open up. Generally, when we close the wound like we normally do with multiple layers, tape and everything, our incisions tend to stay together. The risk would be if somebody is a smoker. Of course, I will not offer the surgery to a smoker. I would have you quit. However, some people will restart smoking or exposed to other smokers in the house, and that can minimize your healing, and therefore wounds can open up even after 6 weeks if you're exposed to that nicotine. When can you do swimming? Usually 2-3 weeks, as long as the incision is fully closed and healed. Back to work depends on the person. I usually recommend 1 to 2 weeks off. However, there are people out there who may need more time off, especially if you're combining procedures. I ask my patient to walk around from day one. I don't want you to be sedentary. So I really hope that most of my patients can get back to work within 10 days. But again, everybody's a little different, so I have to see how you do individually. If you have any other questions, do write here on YouTube, Instagram, or Facebook. Of course, you can always come to our office for consultations and get free consultation on telemedicine. That's an option for you if you're traveling from outside the city. Thank you.